Getting the right screening test at the right time is one of the most important things a man can do for his health. Screenings find diseases early, before you have symptoms, when they're easier to treat. With early detection, colon cancer can be nipped in the bud. Finding diabetes early may help prevent complications such as vision loss, impotence, kidney damage and foot damage. The tests you need are based on your age and risk factors. A risk factor is anything that changes your chance of getting a disease such as cancer. Different cancers have different risk factors. Some risk factors such as smoking and diet can be changed. Others, like a person's age or family history, can't be changed. But having a risk factor, or even many, does not mean that you will get the disease. Just as not having risk factors doesn't mean you won't get the disease. And some people who get the disease may not have had any known risk factors. In this video, we look at tests that every man should undergo to prevent life-threatening conditions and diseases. 1. Testicular cancer. Did you know that testicular cancer has a 95% survival rate if detected early? This uncommon cancer develops in a man's testicles, the reproductive glands that produce sperm. Most cases occur between ages 20 and 54. It is difficult to prevent testicular cancer because it has no definite cause. However, having regular screening and self-examination of the testicles can reduce your chances of developing this cancer. Risk factors of testicular cancer include an undescended testicle. This means that one or both testicles fail to move from the abdomen into the scrotum before birth, family history of testicular cancer, HIV infection, carcinoma in situ of the testicle, having had testicular cancer before, being of a certain race or ethnicity and body size. 2. Prostate cancer. Prostate cancer is cancer that occurs in the prostate, a small walnut-shaped gland in men that produces the seminal fluid that nourishes and transports sperm. Prostate cancer that's detected early when it's still confined to the prostate gland, has a better chance of successful treatment. The risk of prostate cancer increases as you age. Obese men diagnosed with prostate cancer may be more likely to have advanced disease that's more difficult to treat. Risk of prostate cancer can be reduced if you choose a healthy diet full of fruits and vegetables. Avoid high-fat foods and supplements and instead focus on choosing a variety of fruits, vegetables and whole grains. B. Exercise most days of the week. Exercise improves your overall health, helps you maintain your weight and improves your mood. 3. Colorectal cancer. Colorectal cancer is the second most common cause of death from cancer. Men have a slightly higher risk of developing it than women. Majority of colon cancers develop from colon polyps, which are growths found on the inner surface of the colon. To prevent colon cancer, polyps have to be found early and removed through surgery before they can turn cancerous. If and when cancer develops, it can spread to other parts of the body and can be very hard to treat. Colorectal cancer can occur in young adults and teenagers, but the majority of colorectal cancers occur in people older than 50. For colon cancer, the average age at the time of diagnosis for men is 68 and for women is 72. 4. Skin cancer or melanoma. Melanoma is the most serious type of skin cancer that begins in cells known as melanocytes. Melanoma is dangerous because of its ability to spread to other organs more rapidly if it is not treated at an early stage. Symptoms might include a new, unusual growth or a change in an existing mole such as bigger mole diameter, hyperpigmentation, mole border irregularity, or mole color changes. The risk of melanoma increases as people age. The average age of people when it is diagnosed is 65. But melanoma is not uncommon even in younger people, so look out for the above indicators and consult your physician immediately. 5. High blood pressure, hypertension. The risk for high blood pressure increases with age and is also related to weight and lifestyle. High blood pressure can lead to severe complications without any prior symptoms, including an aneurysm, dangerous ballooning of an artery. When detected and treated early, you may reduce your risk for heart disease, stroke, and kidney failure. Know your blood pressure. If it's high, work with your doctor to manage it. 6. Cholesterol levels. It is sometimes called the bad cholesterol because a high LDL level leads to a buildup of cholesterol in your arteries. HDL stands for high-density lipoproteins. It is sometimes called the good cholesterol because it carries cholesterol from other parts of your body back to your liver. Diet change and lifestyle change can help reduce cholesterol levels, preventing life-threatening conditions such as stroke, heart disease and heart attacks. 7. Glaucoma. With all types of glaucoma, the nerve connecting the eye to the brain is damaged, usually due to high eye pressure. Glaucoma is one of the leading causes of blindness for people over the age of 60. While there are no known ways of preventing glaucoma, blindness or significant vision loss from glaucoma can be prevented if the disease is recognized in the early stages. The recommended eye test for glaucoma by age is, under 40, every 2 to 4 years. 40 to 54, every 1 to 3 years. 55 to 64, every 1 to 2 years. 65 up, every 6 to 12 months. Talk with a doctor about earlier, more frequent screening if you fall in a high-risk group, including African Americans, family history of glaucoma, previous eye injury, or if you are on steroid medications.